To give us their take on the COVID situation in the country, we have with us Dr. Ong-Lim of the Health Professionals Alliance Against COVID-19. Doc, how do you assess our current situation? On the one hand, there is rising hope, especially with the arrival of vaccines. On the other hand, there is also rising anxiety now that people are now more conscious about the possibility and likelihood that it is the new variants that are driving the rise in the number of cases in the country. And the bottom line, how do you see it?
Robbie, there's really some cause for concern because the numbers are going up, and regardless of what's driving it, we really do need to be more active in terms of containing the spread of this infection. And fortunately, no, regardless of whether this is being driven up by the variants or just the regular garden variety virus that we've been used to, we still have to do the same thing. So I always keep saying we're so blessed that the only thing that we really need to do is practice apat dapat. Kahit na may variant ka, ganun pa rin ang kinauuwian. And mabuti na nga lang at yun lang ang kailangan.
Yes, but Dr. Ong-Lim, when it comes to the individuals and how we should behave, as you said, that's clear. We just continue what we're doing in terms of best practice. But in terms of policy, in terms of local government, for example, alam nyo naman, pinag-uusapan ngayon, MGCQ, GCQ, should we loosen, should we tighten? When it comes to that level, should we presume that the rising numbers are being driven by the new variants?
I had the opportunity to speak to the local government unit in Pasay when we discussed this because I also work with the COVID-19 task force, the variants task force. And I have to say that they've been very cooperative. No? They actually are very active in terms of a public information campaign. And they also do encourage or try as much as possible to do the appropriate contact tracing, which I think is really the key to be able to contain these infections. Nga lang kasi, the problem is when the cases are reported late, people consult a few days into the illness. Of course, there is a tendency to already have gotten into contact with many people, and it will be difficult to establish who it is that you have actually been exposed to, and it becomes that much more difficult to find out who you should be warning that they might need to be tested or to be observed. So I guess the point here is that as individuals, once again, if we start feeling symptoms, let's not let time pass by too long before consult. And if we are in an area where there's active transmission of cases, then do please consider being tested right away.
Okay, maraming salamat po. That was Dr. Ong-Lim of the Health Professionals Alliance.